So these are members who are leaders of or parties of the task force created to address this issue. And excuse the people in my back, I asked them to stand up when I call them names so you know who they are. Eric Honda is from the Department of Health. He is our Department of Health liaison that we have been meeting with for every day, including Saturdays, Sundays, for over a month now. Dr. John Martel was supposed to be here, but I had notified him last minute, so he just couldn't make it. He's the chief of staff of that medical center. Next is Deputy Fire Chief Lance Uchida. He heads one of the most important task forces in regards to developing programs for prevention and education. Deanna Saka, as you know, is your finance director. She's a task force leader on finances, procurement, and supply management. And Diana Lay, who is responsible for task force on coronavirus pamphlets design and production. Horace Farr, task force leader on elderly activity communication and information. Rose Baptiste on that task force leader on all adult home care facilities. Bill Brihante, task force leader on employee policies and communication and the call center assistance at the EOC. Deputy Police Chief Kenneth Brigado, Thomas Magno, Civil Defense Administrator, and Roxanne Waldron, Director of Parks and Recreation. David Yamamoto, Director of Parks Public Works, and also responsible for all our sign production. And Sharon Hiroda from the County Homeless Coordinator programs relating to homeless. Specific appointments were made on specific tasks this past weekend in regards to what they have to do. I think you know that we collectively, meaning obviously the council, it is from January 31st that we have been doing certain things in regards to daily morning briefings. It is from that day on of 7 days a week for them, including with the administrator from the Department of Health. I'm going to read something that after I leave here, that will be taken to the radio stations for a broadcast. And I read to you. This is a message from your county government to all the people of Hawaii Island. This is about the coronavirus. At this date, there are no confirmed cases of coronavirus in Hawaii County, but our community must come together to take action to prevent its potential spread. It is known that 2 confirmed cases have been identified on the island of Oahu. We will not be able to stop the virus from getting to Hawaii Island, but with your help, we will minimize its impact on families and our community. The County of Hawaii is fully committed to working with state, federal, and private partners. Your county has activated task forces to provide coordinated medical responses, educational, and prevention programs. As community partners, you can make a positive difference right now by staying informed, following health advisories, and taking action to protect yourselves, your family, and your community. Understand that most people who get the virus will not even know they have it. So we must be smart as we go about our everyday activities. Simple things like washing hands, disinfecting counters, greeting our friends with a wave instead of a handshake or a hug can really make a big difference. Additionally, all gatherings should be evaluated on 2 issues. First, should it be held? Secondly, if it is to be held, under what conditions and what measures can be taken to minimize risk to people. Your county government is now evaluating all activities under its authority. This is a community issue and it will take community involvement. And that's the key. You will make that difference. Thank you for your help. I thank you for your caring, and I thank you for listening. And this is your Hawaii County government.
Aaron.
As you know, Today, the World Health Organization classified the coronavirus as a pandemic issue. All our efforts from the people behind you and behind me, rather, and you and everybody else in government and asking the whole community to get involved in this. Obviously, the state government is heavily involved. They are our lead agency in regards to all expertise on the disease itself. But as you know, the governor also declared a state of emergency. I think one of our greatest responsibility is to make sure we give timely and credible information and the best advice possible and programs to try to minimize the wrong information which causes anxiety and fear and everything else. Outside of that, our responsibility for everyone is to do everything we can in regards to normalcy of working. So it's a very, very complex issue in regards to what can happen. I'm asking this council for involvement with us in any way that you feel you can or should, and let us know. If you feel that we are not communicating with you more, and we should, please let us know. I'm sure you know most of the task force members. If you have ideas, you can go directly to them. Because the goal is for a total involvement of community as well as all governments. The task force members were asked to come here today to explain to you basically what they are doing. And I'm going to ask the Deputy Fire Chief to come up here because he heads the most important task force, and that is with regards to prevention programs and educational programs.
Good morning, Council Chair, Council members. Lance Uchida, Deputy Fire Chief with the Hawaii Fire Department. So like the Mayor had, mentioned, he's put the department in charge of what he's calling Task Force 1. And what we're looking at doing is public education, training, and basically community outreach. Our first task was to put together a multidisciplinary team, which we've done, led by the Fire Department in conjunction with Department of Health, the Mayor's Office, Hilo Medical Center, and Civil Defense. From there, we established some goals and objectives, and with that, first goal is to establish an island-wide education prevention program for public, private, businesses, the entire community. Basically, community risk reduction, that's what we're looking at. What we want to do, again, another goal is establish calm in the community, yet emphasize the importance of this issue. Then we want to think proactive, we want to think ahead. We're already a little behind being how widespread this incident is, but we still got to think ahead. What we did next was we identified our target audience, and what we did also is prioritize. So we came up with 7 different distinct groups. First group being the most vulnerable, our kupuna. So we identified the elderly community. We're working with Office of Aging. We're working with the care home providers, and we even were planning to reach out to the skilled nursing, intermediate care, like the life care centers, etc. Everywhere that we can have vulnerable kupuna. I mean, obviously with the data with CDC, those are our most vulnerable populations at this point. Opposite of that, though, we're also want to network with the keikis. When I say that, all the educational institutions, DOE, but not only the DOE. DOE has resources. What we want to reach out to are the charter schools, the private schools, even up to the university, and the preschools in itself as well. Our third group, which that's a beast of a group, but that's the business association and everything that falls within that. When you're talking about airline, transportation, hotels, food establishments, you name it. The mayor has spoke to us this morning, and that's a big part. They have meetings later on today to talk to the business associations, everything that has large gatherings. Okay, our fourth vulnerable population that we identified is the homeless population. Okay, Those are people with limited resources, obviously vulnerable. Okay, so we're already networking with our county homeless coordinator, Sharon here, Hirota. We're looking at the social service providers, Hope Services, etc. Our fifth group, the civic groups. Again, a large group for like churches and non-government organizations, VOAD, the Rotaries, Kiwanis, that type of civic groups that we're looking at to network and outreach. Our sixth group is an important critical infrastructure. That's our public safety group. Yes, they're informed. Yes, they have policies. We just want to make sure law enforcement, DLNR, fire departments, not only our fire department, but our partnering agencies, State Fire, airports, PTA, all within that's going to fall within the public safety group. Make sure that they have their protocols. And if they have questions, that's what our job is in this task force, to make sure they're getting proper information and the training that they need to keep their people safe. Correction officers, all that lumped into our public safety group. Our seventh group, our last group that we looked at, is any planned large gatherings. The mayor's put out a statement today about those large gatherings, the two considerations that we got to look at. But if they're going to have it and they meet the criteria, we want to meet with the organizers to make sure that they can keep their participants, the people who set up, make sure that they're safe. As far as the training program, what we're looking at, we want to identify a clear, concise, updated message. We want to be in line with the Hawaii Department of Health, and that's why they're a big part of our multidisciplinary team. We're not going to move without them. We're not going to create our own message. It's going to be from CDC, Department of Health, to the county, and then out. The theme that we looked at, just listening to the mayor talk also, this is a community issue. We need everybody involved, everybody engaged. They got to get informed, got to get prepared. It takes everyone to help keep us safe. As far as the training curriculum itself, we're working with the Department of Health to build that. That's almost finalized. It should be finalized today, if not tomorrow. We're looking about information about the disease, the latest updates. And from there, we want to go to prevention, right? We want to look at all the general hygiene stuff that everybody's been hearing, but to make sure we're saying the same common message: wash your hands, don't touch your face, maintain social distancing. You know what they say, you touch your face 90 times a day is what they say. You don't even realize that, right? So make sure we wash our hands. Stay home if you're sick, all right? And then a big part is why we're talking about training is about how do you disinfect common touch areas. So we want to be able to have props and things from the EPA and CDC of all the disinfectants that you see that you can hear, in the community and the news, they're having problems with accessing proper disinfectants. So we want to give people or the community solutions, real solutions, not that we create, from CDC, through the Department of Health, from the EPA. From there, we want to address what do you do if you're sick? And we know we have questions about that. So what do I do if we're sick, right? And we want to make sure that we're in line, again, with the hospitals. We don't want to overwhelm the medical care facilities. That's, again, a critical infrastructure. We don't want to overwhelm them. We don't want to contaminate them if it's not needed. So that's our plan with that. And of course, questions and answers, allow opportunity for dialogue and see what the needs of the community or that particular group, what are the needs? Do they need more resources? Do they need more training? With that too, also is important to track the data, making sure that we are performing the proper outreach, and of course, we know this thing is going to be big, but like the mayor has said before, it is a community issue, and it's going to take all of us to get through this. So that's what we have set up. Our first training is targeted for this Friday already. We'll be in the Apuni Center, and we have a whole group, starting with the Office of Aging staff coming in from Friday, and we're moving forward. Any questions?
Well,
I have.
yep. And you said you had 7 groups, right? What were those 7 again? I had the elderly.
Yeah, group number 1 is the elderly. Second group we categorizing as the keiki, basically everything that falls within the educational system.
Oh.
University included, not so much keiki, but still fits in with that group. Third group was the business associations.
Oh,
That's the
business.
big one. Yeah, I mean, didn't name all of them, but we're talking about the malls, the food. I mean, it's huge when you think about everything that's included in that. Farmers market also was brought up. The fourth group was our homeless population.
And then you had the civics, public safety, and then
Large.
planned large gatherings, right?
Correct.
Okay, because I know we're going to have some questions, and I know something is going to come up about marijuana, right? Obviously, so be prepared. You know, I have one question before I call on Ms. Poindexter. What about our healthcare providers? That has to be a group, right? Because I'm understanding from the mainland, you have hospitals whose staff has been decimated to the tune of large percentages, and they're going to be the front line, right? In case, is anything being done about that? I mean, are they identified as a group? Because if we don't, we got to get them on board. Yeah.
Yeah, definitely, and that's a very good point. That's a very critical infrastructure. I can speak as far as the fire department. We put our protocols out there. They have the appropriate PPEs. We have our dispatch center for the fire department doing surveillance, meaning that we have a infectious disease protocol. So when the call comes in and matches certain trigger points like flu-like symptoms, they segue into different questioning to ask about recent travel history. Just so to give the heads up to the responders that they utilize the proper PPE. I mean, you can have times where you can imagine somebody can be sick in a car accident. We're not going to have that information. So there's still risks for the providers. And what we do is, as far as the fire department and EMS, if we have any information, our protocol is to let the receiving hospital know that we have a potential patient, so everybody can get ready.
Yeah. Good. Okay.
Mr. Chairman, may I
Yes,
comment
go
on
ahead.
that? First of all, I wish that Dr. Mantel was here, because Martel rather. I think we, community, should be really proud of what the hospitals are doing. You know, got their instructions, which was we delivered, and all care homes will get the same instructions. But if you've been to the hospital lately, I think you'll be impressed, sir, because they stop you at the entrance, and they question you in regards to, you know, how you feel, this and that. And they have a policy that if you do have any kind of problems health-wise, you're not allowed in. They've changed the visiting time. They've changed the element of how many can see regardless of no more than one visitor per. And of that control group, because they fully realized, and Chairman Chung, what you said, the criticalness of keeping their people healthy.